Hello friends, welcome once again to the last unit, that is unit 5 of your Pharmacology-II BP 503 course. In our earlier lecture we had talked about the pharmacology of the male sex hormone, which is androgen testosterone, and then we started with, in our earlier lecture, in lecture number 39, we talked about pharmacology of estrogen, the female sex hormone. In this lecture we will be talking about pharmacology of progestin and other female sex hormones, and also we will be talking about oral contraceptive agent. I am Dr. Monica Sachdeva, professor at Department of Pharmacy, Rajkumar Goyal Institute of Technology. So let us start with our presentation on the pharmacology of progestin and oral contraceptive agents. Now, what are these progestins? Again, we talked about that the female sex hormones, they are estrogens and they are progestins. So we had already talked about the pharmacology of estrogens. We will be talking about another female sex hormones, progestins or the progesterone. Now, these progestins, they are again one of the important female sex hormones, that is again produced in the ovaries, also produced in the testes and the adrenal glands. The primary function of these progesterones or progestins, it is to convert the estrogen primed endometrium to the secretory ones so that it can maintain the pregnancy. So progestins, in other words, they mean favorable pregnancy. So these progestins, they are required for maintenance of pregnancy, and these progestins, as we talked about of earlier sex hormones, these progestins, they are also the natural ones and the synthetic ones. Now, what are these natural progestins? Natural progestins, that is the progesterone. What is this? That is a progesterone. It is a natural progestin, and from where it is secreted? It is secreted by the corpus luteum in the later half of the menstrual cycle under the influence of luteinizing hormone. Now, if the ovum gets fertilized, it implants itself where the blastocyst is first formed. It starts producing another hormone which is called as the chorionic gonadotropin. This chorionic gonadotropin, it is absorbed into the maternal circulation, and this sustains the corpus luteum in the pregnancy. So this corpus luteum, it secretes the progesterone. During pregnancy, this corpus luteum is sustained and releases progesterone, and that is how the progesterone is, the pregnancy is maintained. And the secretion of this progesterone, it starts from the placenta, from the second trimester of pregnancy till the term. Till term means that is till the birth of a baby or the delivery it takes place. A very small quantity of progesterone is also produced in the males from the adrenal glands as well as from the testes, but the role, what is the role in case of the males, that is still not known. Now, these synthetic progestins, they can be of two types. These are the progesterone derivatives, or they are the 19-nortestosterone derivatives. Now, these progesterone derivatives, the most important one is the medroxyprogesterone acetate, migesterol acetate, and other drug, normegestrol acetate. Then these 19-nortestosterone derivatives, they are again divided into esteranes, they are divided into gonins. These esteranes, they are norethisterone, they are ethinyl estrenol, and these gonanes, they are the norgestrel, but its levo form जो है that is more active, so we write it here as levonorgestrel, or it is desogestrel, norgestamine. These are the other drugs which could be used. So this 19, so we have synthetic progestins as progesterone derivatives and 19 nortestosterone derivatives. Now these progesterone derivatives, they are again pure progestins. They have very weak anti-ovulatory action, and the use of these progesterone derivatives is that they are used primarily in conjunction with the estrogens for the hormone replacement therapy, and also in case of threatened abortion. Threatened abortions means where the pregnancy could not be maintained, these progesterone derivatives could be used. Whereas these 19 non-testosterone derivatives, they again have very weak estrogenic action, they have weak androgenic action, they have weak anabolic action, but they have a very weak very potent anti-ovulatory action, and they are mainly used in the contraceptive pills. So these are the natural ones. Natural, we talked about the progesterone, and the synthetic ones, which are the progesterone derivatives and the 19 non-testosterone derivatives, estrans and gonanes. So these derivatives, they are used mainly as contraceptive pills, whereas these derivatives, they are used with estrogens in case of hormone replacement therapy as well as in case of threatened abortions. Now, coming to the pharmacological actions of these progestins. Now, what are the pharmacological actions? We saw that the major action is that it has to prepare the uterus for the implantation and for the maintenance of pregnancy. So these progestins, they prepare the uterus for nidation and helps in the maintenance of pregnancy. How it maintains pregnancy? It prevents this endometrial shedding, it decreases uterine motility, and it also inhibits the immunological reaction of the fetus. For body, fetus may be an external factor, so it inhibits this progesterone, these progestins, they inhibit that rejection, immunological rejection of the fetus. Then it also has certain specific actions which can act on uterus. When it acts on the uterus, it brings about various secretory changes in the estrogen primed endometrium. It acts on cervix, and it converts the watery secretion which is produced by the estrogen into a very thick, scanty and cellular one which is hostile to sperm penetration. It acts on the vagina also, where it induces pregnancy like changes like leukocyte infiltration, or the epithelium is cornified. Then it also acts on various other tissues, like it acts on the breast and it causes the proliferation of acini in the mammary gland. It acts along with the estrogen and it prepares the breast for lactation after the birth of a baby. Then it may have sedative effects. It causes slight increase in body temperature. Slight increase means it may be 0.5 degrees centigrade increase in the body temperature. How does it increases? It slightly increases the heat production, and this is responsible for the higher temperature, higher body temperature during the luteal phase. Then it may stimulate the respiratory or the respiration at higher doses. Prolonged use of progestins, it can impair glucose tolerance, they also increase the LDL, they lower HDL level. Then it is also a very weak inhibitor of the gonadotropin secretion. So, these are the pharmacological actions of the progestins. Now, how do these progestins act? What is their mechanism of action? Again, they act on the, as we talked about, the earlier androgen receptor and the estrogen receptor. Progesterins, they also act to the receptors which are called as the progesterone receptors, and they are only confined in the genital tract, in the breast, in the CNS, and also in the pituitary. So, same class of receptors, same mechanism, that is upon binding with their receptors, these receptors, they undergo dimerization, it attaches to the progesterone response elements of the target genes, and it regulates the transcription through various co-activators. Now, coming to the pharmacokinetics, that is the absorption, distribution, metabolism and excretion of the progestins. Again, we saw that this natural one, that is the progesterone, it undergoes very high first pass metabolism. So, cannot be given by oral route, given by intramuscular route as oily solution. Then very short half life in the plasma, so they have to be given twice or thrice daily, or in certain cases a novel preparation is now made of the micronized preparation, that is the particle size is reduced, which is rapidly absorbed after its administration by any route. So, novel preparation is the micronized preparation. Then this progesterone is highly bound to the plasma proteins, mainly to the albumin, around 50 to 54%, and also to the cortisol binding protein, around 43 to 48%. Then it undergoes metabolism, or it is reduced to pregnanidiol, pregnanitriol and pregnenolone. These are the three metabolites of progestins, and it then undergoes the conjugation reaction, both the glucuronide conjugation as well as the sulfate conjugation, and they are then excreted in urine, or they are in bile also, because it undergoes enterohepatic circulation, so may be excreted in the feces also. Now, what are the major uses of progesterones or progestins? Now, as we talked about that in along with estrogens, they are primarily, these progestins, they are used as contraceptives. They are also used as the hormone replacement therapy in case of menopausal women, in case of dysfunctional uterine bleeding. Dysfunctional uterine bleeding means when there is heavy bleeding or there is amenorrhea. In that case, progestins could be used. Then in case of endometriosis, where there is inflammation of the endometrium, there is increase in the size, in those cases also progestins can be used. Then also in case of premenstrual syndrome, progestins are used, and also in case of carcinoma of endometrial carcinoma, or we can call it as the endometrium cancer. These are the uses of progestins. So, what are the uses? They can be used as contraceptive, along with estrogen, used as hormone replacement therapy in case of the menopausal women, in dysfunctional uterine bleeding, threatened abortion because it maintains the pregnancy. We have seen the mechanism. In case of endometriosis, and in case of premenstrual syndrome, and also in case of the endometrial carcinoma, these progestins, they can be used. Now, we come to the various side effects of progestins. Now, what are the various side effects? They are that leads to the tenderness in the breast, they can lead to esophageal reflex, mood swings can occur if they are given in higher dosing. Then it can lead to irregular bleeding. Then these 19 derivatives जो हैं, they can lower plasma HDL level and they can promote this atherogenesis, can be the atheromatous plaques can be formed, and long-term use in hormone replacement therapy can increase the risk of breast cancer, can lead to increase in blood sugar, so diabetes may be precipitated, and the intramuscular injections of progesterone, they are very painful. And if given in very early pregnancy, they may cause masculinization of the female fetus, or certain congenital abnormalities could be caused. So that was all about the progestin. Now we will talk about antiprogestin. The drug is mifepristone. What is the drug? This is mifepristone, which belongs to the category of drug antiprogestin. Now, what is this antiprogestin? This is a non-steroid progesterone antagonist, and it has got a very potent anti-progestational and also anti-glucocorticoid and anti-androgenic activity. So it inhibits the actions of the progesterone. So what is the mechanism? This mifepristone, it binds to the progesterone receptor. The affinity is very high and it blocks the action of progesterone. So bind कर प्रोजेस्टेरॉन रिसेप्टर के साथ में उसके एक्शन को, प्रोजेस्टेरॉन के एक्शन को ब्लॉक करता है. So pregnancy which was dependent on this progesterone, that will not be sustained, and that it leads to the abortion of the fetus. Fine. So as we can see from the mechanism of action, progestin का काम है pregnancy को maintain करना, sustain करना, but antiprogestin का काम क्या है? It inhibits the receptor, opposite action है, so it is used in the abortion. Fine. So where is it is used? It is used in termination of pregnancy. Up to 7 weeks of pregnancy can be terminated by using mifepristone. Then before induction of labor, for the delivery, it could or before the surgical abortion, to ripen the cervix, it is used 24 to 30 hours before the abortion is to be done. Then it is used as a post-coital contraceptive, or we also call it as emergency contraceptive pill. We will be talking about it in our just now. Then it is also used in case of the Cushing syndrome because of its action on the glucocorticoid receptor blocking property, because we say that it has got anti-glucocorticoid action also, so it can be used in the Cushing syndrome also. Then some of the side effects are uterine bleeding, and it can also lead to incomplete abortion. So this was about the drug antiprogestin, mifepristone, which is used to terminate pregnancy up to 7 weeks. So this was all about the progestins and the antiprogestin. We will now talk about the contraceptive agents. Now, contraceptive agents, these are the hormonal preparations and are used for the reversible suppression of fertility. These contraceptive agents, hormonal contraceptive agents, they can be given by parenteral route as well as by oral route. So as per your syllabus, we will be talking about the oral contraceptive pills, which are generally also written as OCP. Now, these oral contraceptive pills, they are of 4 types. One are the combined pills, they are phased pill, they are progestin only pill, also called as the mini pill, and another type is the emergency pill, which is also called as the post-coital pill. So, let us start with this. Now, what are these combined pills? We are talking about the oral contraceptives and the oral combined pills which are given. These are the widely used. As the name suggests, it contains both estrogen and it also contains a progestin in a fixed dose. Now, the estrogens which are generally used, they are ethinyl estradiol, which is most commonly used in a dose of 0.02 milligram to 0.05 milligram. Then the progesterone, which is most commonly used, they are the 19 testosterone derivatives, and levonorgestrel drug जो है in a ratio or in a dose of 0.15 milligram, this is generally used. Now, how do they produce their action? Both these drugs, when combined together, they inhibit ovulation. Now, what is the role of the progestin? Progestin का role है कि वो it ensures the bleeding takes place at end of the cycle. So, जब bleeding हो जाएगा, endometrium shed हो जाएगा, so it reduces the risk of the endometrial carcinoma. So, that is the role of progestin here. And this combined pill, it is taken as one tablet for 21 days, which starts on the 5th day of the cycle. Then next dose is taken after a gap of 7 days in which the cycle is taking place. So, this is how the 28-day cycle is maintained. Then we have the phased pills. Phased pills जो हैं, they are various amounts. In this case, fixed amount of estrogen is there, but the progesterone जो है, जो progestin है, उसको हम वेरी करते रहते हैं उसके अमाउंट को depending upon the phase of the menstrual cycle. So, in monophasic we have the estrogen, which is ethinyl estradiol, and this is the norgestrel monophasic हो गया, जहाँ केवल एक phase है, norgestrel हमने दे दिया progestin, and this is now. What happens in biphasic? Again estrogen is kept constant, but जो progestin है वो vary करता है according to the phase of the menstrual cycle. So, this is in biphasic, day 1 to 10 we give ethinyl estradiol, and we give norethindrone 0.5 milligram, and from 11 to 21 days we give ethinyl estradiol 0.035 milligram, and progestin को हमने वेरी कर दिया, अब हमने उसको कर दिया 1 milligram. Then again there are triphasic pills. Triphasic pills again estrogen को हम mid cycle में increase कर देते हैं, और progestin जो है वो उसको भी हम increase करते हैं in 3 successive phases. For example, 1 to 6 day of the cycle, norgestrel 0.05 milligram और estrogen is 30 micrograms. From 7 to 11 days we take ethinyl estradiol 40 micrograms और progesterone को फिर increase कर दिया हमने 0.075 milligram. फिर हमने 17 to 21 जो cycle आया, sorry 12 to 21 days पे we increase it to 30 micrograms, and progesterone increased to 0.125 milligram. Generally given in women who are older than 35 years of age, and certain other risk factors are also there, and schedule is the same: 1 tablet first day of the bleeding till 21 days and followed by a 7 days gap. So, this is how the 28-day cycle is maintained. This we have already talked about. Now, there are certain adverse effects which are associated with the combined pills. Certain mild effects could be nausea or it could be breast tenderness. In certain cases, breakthrough bleeding could be seen. It can lead to onset of migraine. Certain moderate adverse effects could be weight gain, skin pigmentation could occur, acne could occur, and certain serious side effects which are seen with these combined pills, which generally require the cessation of the therapy. They are the thromboembolism disease can occur, hypotension can take place, or myocardial infarction could also occur. Certain gastrointestinal orders, alopecia, that can also occur. So, these cases, serious adverse reactions, they lead to the stoppage of the therapy. Then is the progestin only pill, which we call as the mini pill, in which case there is only progestin is there. We can use norgestrel, norethindrone can also be used, and this is to be taken without any interruption throughout the day or throughout the cycle also. And the mechanism is that it leads to the thinning of the endometrial lining, the cervical mucus, it becomes thick. So, जब thickening हो जाएगी, so what will happen, जो अवम का जो transport है, ट्यूब की जो मोटिलिटी है fallopian tube की, वो decrease कर जाएगी, and the ovum will not be transported, and that will lead to inhibition of ovulation. So, that is how this progestin only pill works. Then is an other drug which is called as the postcoital pill, which is generally taken when there is a coitus and it is an unwanted pregnancy, and levonorgestrel 2 doses 12 hours apart within 72 hours of the unprotected coitus, this drug has to be taken, and it depends upon the phase of the menstrual cycle. It can delay ovulation, or it can prevent fertilization, or it also prevents the implantation of fertilized egg into the uterus. Then this is a centroman developed in India by CDRI, which is a non-steroidal drug, and that is all about the oral contraceptive agents and the progestins. Thank you.